Perubatan Tradisional Cina ataupun TCM.
Very easy to find info about drugs. What are the indication? What are the mechanism of action? How it works? What kind of symptoms or uncomfortable events it will be? But for Chinese medicine, it's a bit different. So for one cancer, 10 patients, 10 different prescriptions. So how am I going to actually bring them and how to make sure those that I give is actually
accurate for that patient?
Yeah,
right?
Because sometimes when we are not open-minded, right? When we study one side, we will tend to believe one side.
Bias lah.
Yeah, but now it's no longer doctors and patient. It's a multidisciplinary team. You need to understand everybody, what's function of everybody, to come out with a solution for these people. Ultimately, what we want is the same outcome. We want this human being or these patients to be healthy. This is what we want.
Medical field ni pancreatic cancer
Bersama saya Dr. Roland Victor.
satu benda yang one of the worst stress can happen bila you makan tak sedap.
Doktor, saya punya culture kena makan nasi.
Zaman moden.
But at every second of your life, you either earn or learn.
Batu Medic Show. Okay, welcome back to another episode of Lesung Batu Medic Show bersama saya Dr. Roland Victor. So anda semua mesti pernah dengar tentang perubatan tradisional Cina ataupun TCM, Chinese medicine, dan penglibatan bagi saya Chinese medicine ni memang dah wujud beribu-ribu tahun. Tetapi saya hari ni berkesempatan dan bertuah untuk berjumpa dengan seorang pegawai farmasi dan juga seorang pakar dalam bahagian perubatan Chinese medicine. Bersama saya Mrs. Christine Chan. Thank you so much hari ni hadir ke Lesung Batu Medic Show. Ni Lesung ni memang nampak old school sikit. So your journey,
Yep.
Daripada from a pharmacist to Chinese medicine, how did that begin?
Okay, thank you, Dr. Roland. I actually started with my parents and my grandparents' family background doesn't have any healthcare knowledge. So there's one time that my grandpa has asthma attack and he went to the hospital and after a few days he passed away. We didn't know what is happening because all I know is there's an inject to the body and he passed on. Yeah. So at that moment, it's split seconds that I found out that healthcare, somebody must have need to know about this knowledge. And that is where we started on looking into this.
How old were you that time?
That was 14.
14.
Yeah. Then my elder cousin started that was Form 5. And she started looking on what we should go, whether it's medicine or pharmacy and so. Yeah. So I joined her for some talks on these degree courses and so. So we decided to go for pharmacy course. With that mindset on, I need to know about healthcare knowledge for my family and also people around me. Yeah. So then I have this opportunity to get the scholarship and go to Australia to study the pharmacy courses.
Nice.
Yeah. At that moment, I didn't know that I would join TCM. Yeah, because all I learned is Western medicine.
Allopathic.
Yeah, allopathic. Yeah, right. And medicine is to treat disease. Yeah, ubat, right. Then my mindset was herbs will cause liver injury, herbs will cause kidney failure, and this kind of thingy.
This is always that narrative that we've been taught, right? And then in our practice, I mean, we worked how many years in government service?
3 years. 9 years. Sorry.
9 years.
Yeah,
so
9 years.
That means like, I mean, being in the wards, being in the clinics,
Yeah.
being in on call, everything. It's always like, oh, hepatotoxicity.
Yeah.
Always liver
Yes.
problem, kidney problem, and then,
Yeah.
but then then you started realizing that hey, come on, something's not right here.
Yeah. Because that's what we learned from during the
Theory
degree type, right? When in real life we always put into what we learn, and then we will ask ada makan apa-apa ubat tak?
Jamu.
Herba yang plant dekat rumah ada masak air didih lepas tu minum tak? All this thingy. Then kalau ada, then we will stop. ask them, jangan makan, this kind. Because we don't know about all these thingy, whether is it helpful. So all we can know is, because Western medicine, we know very clearly what kind of side effects, uncomfortable events are there.
Correct.
But all these plants, we don't know at all. Yeah. Then in Ampang Hospital, which is my first posting, we do see a lot of hemato patients, blood cancer patients. So they bring a lot of supplements, all types, vitamins, all types, and also medicine. So I see that there are somebody that needs to be taught on whether this kind of vitamin supplements, are they sufficient, are they needed, and so. Because all they know is they just try whatever they receive.
People say it's good, try.
Yeah. Neighbor A say, this is good, try. Yeah. Neighbor B brings the plant, and they will try again. All this, they just try whatever they can because they know that time is limited. But who is going to guide them? That's the part. So that brings me to how I can actually improve myself to help them since I'm in the pharmacy line. Because we do counsel patients all the time. Yeah. Then when I moved on my career, I transferred to National Cancer, which all the solid cancer patients are there.
In Putrajaya.
In Putrajaya. That was when they started setting up in 2018. I joined them in 2019. And I was so surprised that there's this traditional and complementary medicine unit in the public sector. And only then I know that actually each state there is this traditional and complementary medicine unit providing traditional and complementary services. That includes acupuncture, Malay medicine, Indian medicine, and subsequent, Chinese medicine as well. But herbs, because nobody have this expertise on this, we don't have a team to actually guide them how to use. So at that point in time, they only indicate for cancer patients as to improve their quality of life.
That's the definition. Not specific, just like for general wellness or something like that.
Yeah, it's only for that improve quality of life because they don't want that this unit may cause trouble to patients. They might thought that it's an alternative. People try to not going for chemo, radio. Instead, they go for other alternative, which is safer, which is natural. Yeah, that is why the government put that as an indication. I was very skeptical at that moment, like I mentioned to you, right? It's something that I think, why am I at that positions that my mindset is already set that it will cause
liver
problem and I have to counsel them and try to convince them to take the herbs because I'm the one who prepare the herbs to them. So I started learning, and good that we have a team with medical doctors with the TCM background. We have nurses, we have all other allied health to actually support and how we can actually go further. So step by step, we learn the way, and we want to make a bridge between these both medicines because in Malaysia, Western medicine is the mainstream, but this complementary medicine, somehow it complements to the mainstream, that it needs to exist together in a way that somebody needs to understand both sides to bring them together. This is what we see the gaps there. How are we going to bring that gap together?
And how big was your team at that point when 2018?
There's only less than 10. Yeah.
Pharmacists, doctors, nurses?
We have 2 pharmacists, 1 doctor, 2 TCM, purely TCM practitioner, 1 Malay medicine practitioner, acupuncturist,
Ayurvedic?
2 to 3 nurses.
Okay.
Ayurvedic, we don't put in the National Cancer itself because we don't have that expert there. So government sent there is a MOU between the government from India and Malaysia. They send the Ayurvedic expert over. So we place them at the hospital Port Dickson.
Okay.
Yeah, there is a lot of patients there for Ayurveda.
Getting Ayurvedic therapy in the government setting.
Yes.
Wow. This is something first time I'm hearing.
Yeah, but there is a specific indication.
Indications. Understand.
I think for the past few years, they bring the Basti therapy as well.
Okay.
It's one of the Ayurveda medicine.
Practice lah. Understand.
Yeah.
And so how did your journey then go into TCM?
Okay. So I was placed in that area. Yeah. So they wanted to start with the TCM herbal therapy. So there is a pharmacist there to actually safeguard the safety and quality sides. Yeah. So at that point in time, the oncologists are very reluctant to see us. All they say is we can only counsel patients not to take the herbs.
Oh, still.
Yes, at that point in time. Yeah, so we tried to convince them. We started with research and to convince them we have this knowledge to make sure that the effectiveness and safety and quality is safeguarded. We bring them in to join us as a research team. So there comes in when the referral system comes in. Yeah, the oncologists will refer to us to tell us which kind of patients they would like us to actually handle and how we should actually handle. We will tell them as well.
So vice versa thing lah.
Yes.
Okay.
And good thing in National Cancer is we do have a team that we call, we have a grand ward round. Yeah, we have oncologist team, we have us, pharmacy team, physio team, everybody will go to the ward to see the bed by bed on once a month, if I'm not mistaken.
Okay.
Yeah, then we will see what services and how we can actually help this patient. So everybody knows the plan and how and when we should go in.
Okay.
Yeah,
okay.
That's the good part that I see during that time. So after that, I see that myself, I don't have much knowledge on safety because very easy to find info about drugs. What are the indication? What are the mechanism of action? How it works? What kind of symptoms or uncomfortable events it will be? But for Chinese medicine, it's a bit different. So for one cancer, 10 patients, 10 different prescriptions. So how am I going to actually bring them and how to make sure those that I give is actually
accurate for that patient?
Yeah,
right?
That's the thing. So I've did this opportunity to go to China and Taiwan. That is why I study my master in Taiwan to really understand the safety quality. Yeah. So then that is my chance to actually put in more foundation of myself and so that I can apply more at this time in point.
How
in
long?
time.
How long were you there in Taiwan?
My master is 2 years.
You were there full time there.
Full time. Yeah.
I see. So this is interesting because the experience in a country that is like example like Taiwan, I know that a lot of patients here, especially Chinese community, who go abroad when there is a onco issue.
Yeah.
They would go abroad and they go to Taiwan because they said like the facility, the knowledge, the expertise there is so different from here. Do you agree with that?
Yes and no. Of course, Malaysia
Also got definitely decent amount of talents to treat.
That is why our medical tourism is so high. Yeah. There are quite surprised me was there are TCM practitioners who study 7 to 9 years instead of 5 years for medical doctors. Because I think the good system on that is because the first 3 years, all the medicine students, whether it's Western or Chinese, they will go to the same system.
Okay.
They will study together. Until the 4th year, they will separate out whether you want to go for Chinese medicine or Western. Yeah, I think this is a good part into during the first 3 years, they have already started integrating together. They know who is going to study Chinese medicine. They know who is going to study Western medicine. And that helps the whole system in Taiwan.
To bridge it, right?
Yes. And the second thing is Chinese medicine, there are certain criteria that are covered under their healthcare insurance.
Okay.
Yeah, I think only Taiwan is having this healthcare coverage for certain the granules and so. And if you were to say whether is it safe and how are you going to make sure this quality of these herbs and so, what we use is currently using the granules, concentrated granules.
Okay.
So each comes with the certificate of analysis.
Okay.
How Taiwan comes in with this is because at first point in time, they prepare this, they manufacture this to Japan. You know Japan? They wanted
Yeah,
everything
QC is
very,
very high,
high.
Correct.
Because when I heard this, I was like, wow, yeah, then I trust the quality control on that side. Because in Japan, their herbs, they need to be 2 cm, 2 cm, all very accurate. For all 10 of the red beans, they have to be same size so that it can make sure the dosage is the same. Yeah, this is how
The
precise
standardization,
is the standardization. So Taiwan learned it that way. So I trust that the concentrated granules will help with the industry. Yeah, of course, when I study in Taiwan, there are many professionals that I look into, I learn from. There are a lot of pharmacists that are actually similar to me. Yeah, they study both sides. Just that in Malaysia, it's a bit different. Theirs mostly are Chinese. Their traditional medicine is traditional Chinese medicine. But in Malaysia, we are multinational, multicultural. We have all types.
Options, right?
Yeah.
Our options are thing, but at the same time, like you said earlier, because the mainstream is already so indoctrinated with allopathy, still maybe like WHO even says that still the secondary option for people is still to go to traditional medicine globally. And here you also see like a lot of patients sometimes maybe of Chinese ethnicity. Sometimes you think, I want to go and see the sensei first. I want to go and see the herbalist or go to a Chinese medicinal shop and say like, yeah, I've got this cough or I have some bowel pain. Okay, anything I prescribe. So the guy takes the herbs and mix and pack it. We have seen that many times in my life. And also, the acceptance of the other races, for example, like Indians and Chinese, towards Chinese medicine, or even now, like you see the booming of like Ayurvedic or traditional Nusantara medicine and everything, because like Indonesia is quite big with that. That knowledge is also coming in, and there's also now room for all of this coming in. And now we have the TCM Act that has been placed active really like just recently.
Yes.
So that is good because there's some good governance.
Yes.
Acceptance-wise, when you were there, did you feel that, hey, why should I come back or not? Since like, how are people going to accept this practice? Did you think about that when after finishing your training in Taiwan?
Oh, okay. Because we work hand in hand with the government at that point
time
in
you were
time.
still in service lah.
I'm still in service.
Okay.
Yeah. So what we did is we don't really just focus on clinical and research. We also do how to move forward in the whole government setting. Yeah. So of course there are many challenges that brings in every now and then. Yeah. So what we really want is first one is education. Yeah. Second one is the one that recognize of the practices and also the practitioners. This helps to actually strengthen the way on those who practices all these medicines will actually give a safeguard to the public. Second one is educations that I mentioned. Education towards the public onto how and when to get this medicine. Like you mentioned, sometimes they try to run away from the Western and try to find the alternative. So there are patients that actually have the surgery date or even chemo date. They just come over and ask, I have tomorrow I'm going for surgery. Should I just cancel my surgery and go for TCM? Yeah. These people, what we want is we hope the person are able to take charge back to their health and they understand and able to weigh both sides, pros and cons, and whether which should be on place. So to us, currently there's a shift is more towards like the practitioners or even doctors, they want patients to understand rather than we tell patients what to do. So our side, we will tell patients, Western side, this will help you. If you go for surgery, how many % you will get better. If you avoid surgery, you go for this TCM. What are the percentage there? And if you combine them and when to come in, how much the percentage there? I think to let the public vision how it's the whole system when they integrate together helps them. They are able to make the decisions on going Western or the TCM side.
Traditional.
Yeah. Another side on the educations would be the professional sides, that would be a bit difficult.
Especially understanding and allowing acceptance of the practitioners to understand, like, look, there is a lot of power and in therapy, in also in traditional.
Yes.
That is going to be a big mountain.
Yeah. So these two sides are actually, what they learn is totally different. So Western doctors will say no for TCM. TCM,
say no. Sometimes.
Traditional complementary medicine, they think that because it's more towards a healing part, as long as you are able to heal, probably you don't have to go. I wouldn't say right or wrong, because at certain point, some of the symptoms might be able to relieve. I would say symptoms, not disease. Yeah. So both sides need to understand. So I think the education system, they need to put in both knowledges during their education. Yeah, I see recently, I think pharmacy courses, there are quite many of the pharmacy courses that if there is these elective courses to understand TNCM in Malaysia, all types.
And it's already been in like our public universities and all, they are having the subject ready.
Yes. Yeah, even the Master of Clinical Clinical Pharmacy in UKM, they have this course in TNCM course in their part of their credit. Yeah, because I teach them, so I know.
So you and in practice at the moment, I mean, you have your own practice location at the moment, I think in Klang Valley. How has the approach been now, since you have now experienced both of it? So that means like you get to see, like, okay, prescribing someone with an allopathic kind of drug, technically petropharma based medication, and then looking into herbs. Of course, maybe now you have how is the practice? You still have the roots, you still have the flowers or herbs, or it's all like following the Taiwan approach where everything is already in like specific concentrates. How you are doing it, because it's going to be different from there.
Yeah, when I left government to join this in Klang Valley, what we do is a bit different, because in government sites it's only cancer patients. So when we move to private setting, all types of patients. So what we want is towards every single specialty, similar to Western South. So when we do the planning, our mindset is very clear that we want to do a similar system, similar to the Western South. So we do have the GP clinics, we do have the specialists, just that we don't have the hospitals. Yeah. So this helps to recruit team members who have really strong background on both sides. For instance, gynae, we have TCM practitioners who really focusing and even master in gynae sites. Okay. We have people in the oncology sites, cancer sites. We have people with orthopedic sites. And we keep on making sure from the effective sites, I don't have much issues on that part, as long as they are graduating from universities or the qualifications are purely agreed from the KKM sites. Yeah. Then that part, I'm not too worried, but we have to keep on giving them the educations on the Western sites on how to actually ensure the person is stable before they can actually continue with the TCM treatments. So because some acute cases, emergency is the fastest. So why not just refer to patients to the emergency? Don't try to hold it to yourself.
Correct.
And try to find out the solutions and things that you can do wonders. Nobody can do wonders. Yeah. So from pharmacist's point of view, because we want a safety and quality, and we have experience in the government setting, so we adopt and put it into the current setting. So most of the products are actually under granules. So it's according to prescription. So similar. I will have to verify all the prescription. I will have to do the medical history taking, similar to pharmacy sites, all types. And then in case there is a necessary, the practitioners will refer me for consultation, for pharmacy consultation and counseling. So that part, the patients will bring all types, from medicines to supplements, food. Then they will bring the herbs, everything. I will have to counsel everything. Because I have to understand the whole history, and then we'll see plan. It will take hours for me because we have to see drug-drug interaction, drug-herbs interaction.
I was just about to ask that
Herbs
question.
interactions, herb-food interaction, drug-food interactions. That's the point.
There's a lot of interaction
Yes.
to think
Yeah.
about.
Yeah.
Because you see, like in mainstream, we're just only looking at just the drug interaction and or side effects or risk. Or maybe you're having a polytherapy and stuff like that. So in this case, it's just because it's going to be herbs. We're going to think about the food. We're going to think about the mainstream medicine that they're taking.
Yeah. That's
and
the difficult
how
part.
and I mean, it's so fascinating to understand that like I always say to my patients, like, do you think that Chinese medicine is complementary? I honestly feel it's not complementary. The sciences that they had probably exist like maybe thousands of years. They definitely, like countries like in China, had their own schools, had their own sort of university or academia. Ayurvedic, maybe thousands of it had their own academia to
Yes.
come this far.
Yes.
It's not just going to be like with looking at it like complementary. I mean, using the word complementary for me, I still think it's wrong. They should be sitting same par as allopathic medicine. But I think every single therapy has their own purpose to play. And when you mention that there are therapists who are already like really dwelling into specific medical concerns. I mean, it's like almost like they are not, like almost like a onco in TCM, onco in Ayurvedic, or onco in like orthopedic, like joint pain issues
Yeah.
and stuff. And I'm pretty sure so that there's so many traditional medicine journals, conference that these experts also go to.
Yeah.
They have?
Yes.
And how of I mean, is there anything like that in this region, or everybody has to go to like mainland Taiwan, everything for conference?
Currently, the conferences for TCM, traditional and complementary medicine, I would say, in certain countries, they also call it alternative medicine. So there are all places from, even the Western countries are having all these conferences, from Australia to Austria, I think Germany. They do have, of course, it will be a bit different because even there is a similarity, for instance, Oriental medicine, Korean medicine, Japan medicine, and Chinese medicine. They do have a similarity in between.
Some
but
correlations
yeah,
and product,
yeah,
yeah.
but they have some differences onto the philosophies, and so of course because it depends on the environment, on the areas of the people, and so that is why there's a changes on that. Like you mentioned, it's so long history. You can see that it's not stay put at a traditional way. Because, for instance, I think I saw one of the sentence in the websites mentioning that what are the success story of the traditional medicine? Why do you say that it's evidence-based? But if you say medicine is also part of the success story of the traditional medicine,
Correct.
because there are many medicines are actually derived from
From traditional medicine.
Yeah.
Exactly.
So if
Once
you
already
mention-
extract the chemical compound, it's now mainstream. Change a few bonds, mainstream.
Yeah, you remember in 2016, the Nobel Prize, one of the Nobel Prize for the anti-malaria drug, it's actually derived from the plant as well. This is how one of the blooming in TCM practices mentioning that because of this, because this was written in the pharmacopoeia mentioning that this herbs is actually for anti-malaria, and it has been used for 1,000 years, and because it has been able to extract into drug, and it become the anti-malaria drug, and now they have recognized this as a Nobel Prize. So this is one of the thingy that everybody was telling in 2016.
Was
As
like
this is
a
the
big
evidence.
win for TCM, right?
Yeah.
Yeah. I wanted to ask this interesting question because you put it out just now, like the acceptance of TCM in European countries, Western countries, and also there's symposium, conferences, and going on. Like based on your practice, right? By genetic exposure, do you see that there is a different drug-drug interaction with people? I mean, from different race or different ethnicity, is there any difference?
I would say yes. Yeah. Because in Chinese medicine philosophy, there is this way that I do see practitioners when the patients wants to go overseas, And because of the environmental changes, they will change the whole prescription because of the weather. So it's more towards an holistic approach. I think it will be similar for all traditional medicine because I think environment, food that we eat, and the cultural and also the genetic that you mentioned, it's actually part of their diagnosis as well to come out with a prescription. So I would say yes for genetic because people might not be able to convince because there's no evidence. But for the past, how are they going to check the genetic in the past?
Now we know.
Yes, but yes, we will check on the family history and also the person, whether the people is from which area, Indonesia, UK, India, or even Philippines, Thailand, who comes over to see us. There is a change of medication. If the person who goes overseas because of the season change, there is a difference of the medications on their own medication as well. So I see it covers everything that needs before the practitioner needs to decide what prescription needs to provide.
True.
Yeah.
Understand. And as you also focus on disease-based therapies, how about supplementation? Does that exist also in traditional medicine? Definitely, right?
Okay. For traditional and complementary, I believe they focus on the holistic approach. They don't really think that treatment is the only process that they should go for. Prevention is also part that should go for, because maintaining the whole own health is one of the things that they need to look to. So I would say that supplementation is one of the way, because some people there is this we call healthy people and sick people. There is this intermediate in between that we are trying to move these people to healthy people. This comes into place into modern medicine's languages will be, if you check the genetic or if you check your blood results, when there's a deviation or any weird numbers, that's the alert of your body alertness that you need to be aware on. Then how are you going to reduce the risk towards the not to get sick? Yeah, in Chinese medicine it's similar, or even in traditional medicine, I think it's similar. They want you to maintain your health at a good state. So that is why supplementations comes in, whether is it as food, as the supplementary therapies, or as a treatment. Yeah.
I see. And in fact, there's something that I think I must have read many times in Chinese medicine. There's a lot of perspective understanding the elements, like the fire element, the earth element, and all of this. Like I do a lot of hormonal work in the clinic. You see a lot of things like the discussion of this, like alignment of the chi, alignment of the chakra, alignment of this materials. When we look back, when I read and I see what modern medicine is, actually it just matches.
Yes.
I think you would understand like how it just looks the same,
Yeah.
because of at that time they didn't have enough of laboratory diagnosis. A lot of feel. Visualization, examination, and just by looking at certain symptoms and patterns on the body, okay, we know cortisol is low. Oh, most likely thyroid is too high, so we need to counter it with certain herbs and therapy. So it's fantastic to hear that. Your center, I think, is a pretty established center. Foreign tourists, local people, are they embracing TCM a lot, or people are coming from overseas to get advice and therapy?
We do have a lot of overseas patients. They come for those who are nearer, for example, Singapore or Thailand or Indonesia. They come in the morning and they fly back in the evening. Yeah, I think that's a very good testimonial, I would say, for not just our center. It's really for the medical tourism of Malaysia, that people are actually coming in to seek medication or medicines in Malaysia.
And also the acceptance of these traditional approaches for therapy.
Yeah, I think it started off, I think it's by chance, because during the COVID time, and the people has been telling to take herbs, and so because there's only vaccine, and so people crying for help. So at that point in time, we try to help them to actually let them understand the red flags on what kind of symptoms that they will have, and how to actually diagnose whether within family members they started passing and everybody have their symptoms. Yeah, then they will do the teleconsultations. So that is when we started with the overseas patients asking for help. Because some of the places that don't have these complementary therapies, they just want them to stay at home. That's it. Yeah, you don't infect people. You just stay at home. That's all. And so it happens that they have family members in Malaysia that suggest them to actually do a teleconsultation with us, and so
and
that's,
you all provide that service.
Yeah, that's when we started with the services to help them, and we understand that actually staying calm, letting the patient stay calm is the way forward during that point in time. If you remember the COVID time, everybody was like, don't know what to do, staying at home. Yeah. So I think that's the education comes in to tell them and how and so. And they are surprised that we are able to, through conversations, we are able to convince them and actually what they should do, what they should not, and how we can actually provide. And so then we started having patients flying over, and that's
great.
that.
And just to ask also, when you said when you expand this health tourism, the continuation of care will also take place. That means it's not like a one-off. That means it's sort of like a follow-up, maybe via online and stuff. So let's just say if they need a prescription, is there a lot of challenges to like ship out traditional medicine?
Okay. Yeah, so it depends on the countries that they are staying at. For instance, Australia is very difficult for them to actually very difficult for us to actually post the medication over as well. But if the someone is able to bring over, then it's easier, because all our prescriptions comes with the prescription list that and the letter to show to the immigrations that this is for the medication that needs to have a continuation of treatments. Yeah, for others, some of them they take 2 to 3 months and then they just fly back and they just come over.
Oh, they are here for the therapy for that long of time.
Yeah, so it depends on the disease or type of patients. For instance, cancer patients. Some cancer patients, they might want to take the herbs for 5 years because the survival rate, and so the study shows that 5 years is the one that we look at. So some they want the maintenance of the health, and also to improve the quality of life is for a certain period of time. Then they will take herbs for 2 to 3 months, and so of course at the starting initiation part we will probably give 1 or 2 weeks, because we want to see whether there's any uncomfortable events, or we want to see whether it's suitability or any changes, or how to actually support the symptoms, and so for maintenance wise it's easier because the prescription is similar, so 2 to 3 months they can actually collect. For UK sites, we do send over. There's one time we send via DHL.
Okay.
Yeah, within 1 week the person wants to take medication. Of course, there are certain places, for instance, Australia, they do have concentrated granules. Okay. So we will prescribe and they can purchase out there.
Okay.
Yeah,
so there's
it's fine
also
as well.
a sort of like a network outside
Yeah.
means like there's some sort of like a peer-to-peer networking that you just have to prescribe and they can actually get the product there. So that's great. And a couple of questions before we wrap up. The community, I mean, how many people are there like you out there in Malaysia? And how big is it going to get?
For my similar background as myself, I think less than 20, but I'm not sure. Probably there are out there that they do at their own way that we are not able to understand or recognize them. Yeah. At first point in time, I think about 10 of us are doing all these TNCM in the units, knowing both sides. But in terms of studying master or PhD, there are not many. Yeah. They do have pharmacists to actually study bachelor degree in TCM, and they take another 5 years, and they are now practitioners. There are people out there as well are doing this. Of course, we are happy to see more and more integrative, not just pharmacy and the TCM. There, we hope that more of the both backgrounds coming in. Yeah, we do have doctors who are taking acupuncture studies and so.
I know that.
Yeah. So I hope that these people can actually come together to bridge both sides. Yeah, because sometimes when we unable to tell those that practitioners that these are important, we have to play a role to tell them how and why. With both knowledge, we are able to tell the same language, so it's easier for them to understand as well. Yeah, so like you mentioned, it's actually overlapping, just that they study that time, they don't have another sides of the story.
Correct.
Yeah, so we are the one who actually storyteller of both sides.
Bridge the gap.
Yeah.
Okay, so last question. Any advice for people out there, maybe young individuals, maybe in school, college, sometimes just thinking maybe medicine is something that I want, but maybe I want something with a different twist. I say to them that this segment, in the next 5 years to 10 years, is going to be a boom segment. It is a boom segment. Healthcare wellness is going to be a big segment. We've seen the effect after the pandemic. We can see what's the trajectory like. And it's opportunity to gain this kind of skill, and you are in that segment. Me, in more of integrative. We see that perspective. What's your advice to people?
Actually,
Even pharmacists.
yeah, I actually can see the shift there towards the wellness or preventative medicines or integrative medicines. Because when I see students out there, I see they don't really just choose medicine. I want to be a doctor, and so they do opt for other chances or other studies that they can have. Yeah, the opportunity is there and the blooming is there. So I think the openness on to accepting what is available and what we can foresee is one of the things. Because sometimes when we are not open-minded, right, when we study one side, we will tend to believe one side.
Bias lah.
Yeah. But
Really
now it's no longer doctors and patient. It's a multidisciplinary team. You need to understand everybody, what's function of everybody, to come out with a solution for these people. Ultimately, what we want is the same outcome. We want this human being or these patients to be healthy. This is what we want.
True.
Yeah. So everybody comes with the same. Why can't we hand in hand work together? I think the timeline to make the person healthy is even faster rather than one-to-one, right?
True. And for the young people who are maybe in thought of going into segment of medicine or pharmacies out there, would you think that this is an interesting journey also to consider?
Yeah, I think yes. Some of them who actually consulted me whether because I have both sides, so they will ask pharmacy what you do, and actually what you study, TCM what you study, actually what you do. They are exploring. So I think it's good time to explore every single thing and see where is your passion. I wouldn't say that just try the new ones, the TCM which is blooming now, because we need both sides to be balanced as well. Yeah, so passion is one that you need to really look into, because without passion in healthcare setting, you will be easily burn out, one thing. And if you don't have that passion, you won't want to have the ultimate aim to help the people, and you need the people to help you. Yeah, this is the thing that healthcare professionals are having now. So if you have that passion, you can be you can stay in the healthcare to really see what you want to do lah.
True. That's why healthcare is always called a practice. We always learn all the time. And I kind of feel that the approach now, the openness of people, acceptance of traditional medicine is becoming part. They know the function of allopathic, and governments or government agencies also are now bringing in, like example, the experience of TCM in government hospitals and everything. Unfortunately, private hospitals still have some form of limitation. You can have a TCM in a government setting, but to have a TCM practice in a hospital licensing still an issue. Maybe we will cross that one day. But the role play of insurance companies, there are few I know that are accepting like acupuncture, and then it can be covered by the premium that you pay and stuff. So that's a good start. But once the TCM Act goes more into force, the people start to push the insurance company, hey, give us also the benefits that we have, the option of maybe I have some joint pain. Rather than just going and seeing physio, can I also have acupuncture, dry needling approach? So when that comes in, then, and the regulation of maybe the fee scheduling and all come in, and the herbs, I mean, like your community starts to like, okay, we schedule the pricing, we sort of like standardize certain thing, we all agree upon a certain stand. Then the insurance company also can, okay, there is some form of QC or standard where we can give the insurance subscribers, the people, the public, to pick. They want to go this way, they want to go that way, they want to go in the middle at a decent amount standardization of price. I think at that point, I think we already have to think that direction.
Yeah.
Because if not miss, this burnout issue, one will happen in all sectors. And we don't get this healthy kind of country. We have more sick people than healthy people. So the pendulum is tipping on one side.
Yeah.
Okay. With that, thank you so much for coming, Ms. Cheng, to Lesung Batu Medic Show. I hope for those people who have viewed this episode, they can actually go and read the full write-up in 12080. Our print edition, and also we can go in to follow all our posts on TikTok, Facebook, and also Instagram, Lesung Batu Medic Show. Until we meet in our next episode, kita lesung kau-kau.